welcome to H360 Live. My name is Dave Duplay, and I'm joined here in the studio this afternoon by my friend and colleague from Healthy O360, Ms. Courtland Long. Well, Courtland, it's so good to see you today.
Good to see you, Dave.
How are things?
Things are very well.
Well, you know, we have a great show for everyone today because Alix Furer is coming into the studio. And, you know, Alix is a friend of Healthy O360's. We met her several years ago at a really important heart walk that we attended. And, you know, her story is so inspirational. She's had several heart operations, and now she is on the waiting list for a heart transplant. But she's got such a great attitude. We're going to talk to her about her health journey. We're going to talk about some technology that she's wearing. We'll talk about and see that's really, you know, keeping her heart in shape until she is ready for the transplant. So I can't wait to get her in the studio to talk all about this. But Courtland, as you know, we have some health tips for our audience today, and these health tips really align well with what we're going to talk to Alix about.
These tips are great. You know, we know that oftentimes expecting mothers really want to know what they can do to ensure that the pregnancy and their child is going to be as happy and healthy as it can be. So we're going to cover some tips on how to hopefully prevent some birth and heart defects, but it's really important to keep in mind that most congenital heart defects, the cause is unknown, and many times it may not be possible to prevent these conditions. But our first tip here is to control chronic medical conditions. Now, if you are living with diabetes and pregnant, you want to make sure that you're keeping your blood sugars under control, because this can really help to reduce the risk of heart defects. If you're living with other conditions where you need medications such as epilepsy, you really want to be talking with your doctor to talk through the risks and benefits of these medications and make sure everything is okay for your pregnancy.
You know, Courtland, that's such a great tip. Compliance and persistency with medication. You know, a pregnant mother has to take care of herself. If she doesn't, it's going to be difficult to take care of the little one that she's carrying around. But compliance and persistency, it always amazes me the number of people living with chronic illness that drop off their medications. I don't understand that. So if you're on a medication, please follow your doctor's orders. That's a great tip. Well, Courtland, tip number 2 is avoid harmful substances. And now, when I say that, the first thing that jumps to your mind, if you're an expecting mother, is stay away from alcohol and tobacco use. Well, duh, right? I mean, that's a no-brainer there. But there are more to consider. Now, if you're expecting, your significant other, as a family, go through your house, look under the sink, look for these cleaning supplies that have a high degree of ammonia or other chemicals, because inhaling that while you're expecting is not good. Inhaling it at any point in time is really not good. So go through those kitchen cabinets, go through your laundry room, look at the labels, see what's in there, go for some organic stuff, you know, or a little less harsh cleaning solution to take care of your cleaning needs. But you really have to read the labels here and understand what is in those cleaning products that you're using. Stay away from. The last thing I want to say about this one, Courtland, is develop the honey-do list, okay? Here you go. Now, if you want to paint that nursery, getting ready for the little one to arrive, you want to watch painting and being around, again, fumes and chemicals that are not going to be great for you or the little one you're carrying. So be careful, form that honey-do list, get the significant other or the husband up there to do the painting. You relax, moms, take it easy, and we'll go from there.
That's a great tip, Dave, and I think one that a lot of people don't think about is your cleaning products. And you know, Fran Drescher had a really great campaign with her organization, Cancer Schmancer, where she wanted everyone to take a look at their products and throw away the toxic products. So don't be afraid to toss those in the garbage. Now, our third and final tip is take a multivitamin with folic acid. Now, when you're pregnant, there's some foods that you want to make sure you're getting a lot of, and some foods you want to make sure you're avoiding. So you want to be getting a daily consumption of about 400 micrograms of folic acid. This has been shown to reduce birth defects in the brain and spinal cord, and also help reduce heart defects as well.
Yeah, absolutely. That's another good tip. You know, a multivitamin, I take a multivitamin every day. I take a little bit of fish oil, I take some CoQ10, some glucosamine. Yeah, I take a little bit of this and a little bit of that. But you're right, especially if you're not eating a balanced diet. It's so important for everyone. You know, and quite frankly, for those husbands and fathers to be out there, it's a stressful time, especially if it's your first one. And, you know, you're running around doing a lot of stuff, probably not eating as healthy as you should. maybe not getting all that exercise, especially when the new little one arrives at home. You know, you're up all night. So that multivitamin is really important. Well, Courtland, let's review one more time the 3 tips that we shared with the audience.
Number 1, control chronic medical conditions.
Avoid those harmful substances.
Take a multivitamin with folic acid.
Okay, well, there you have it. Great tips, Courtland. Thanks for that. Now, this is one of my favorite parts of the show because we send our interns out in the fields to the streets of New York, to Bryant Park, to see what our friendly New Yorkers know about some of these health tips. And this is a great video. Our interns did such a fantastic job out there. So let's see what New Yorkers know about some of these health tips. You want to watch?
I would love to.
Okay, guys, roll the film, please.
Do you know what a congenital heart defect, or CHD, is?
Just a little bit. I imagine congenital heart disease has to do with some kind of defect that you have in your heart.
No.
No, I don't.
I assume it's something you're born with, and it's a problem with your heart.
Can you guess how common of a diagnosis is congenital heart defect?
At birth, you mean?
Yes.
I don't know.
I'm not sure, although now I remember I had a friend a long time ago who had twins, and I believe it was either one or both of them had heart defects. They had holes in their hearts.
Yes, I've heard it's pretty common.
1 in 10 births.
It's about 40,000 newborns per year in the United States. So for a child diagnosed with a congenital heart defect, what are some tips that you might give to the parent to keep the child's heart strong and healthy?
Monitor the situation closely and see a physician.
That I'm not that familiar with.
Well, I mean, depending on the age, certainly I'm sure breastfeeding when they're born helps because it helps build a better immune system. And then, you know, a healthy diet with not very low fat, even though I know young children when they're born require more fat than the average when you're older because they're developing.
I would have to say probably a consistent healthy diet, probably lots of vegetables and fruits and not a lot of red meat. And probably, I don't know if they can take baby aspirin, if possible, I think. And then exercise, but light, probably.
Okay, awesome. That's some great advice. What are some things that might contribute to a pregnant woman having a child with a CHD?
I would assume smoking and drinking.
I'm not sure. Is it hereditary?
You know, possibly just poor genes and just passed it on to the child at this point.
Maintain a very healthy diet and exercise while they are pregnant to ensure, you know, a better outcome for the child.
Do you think a CHD diagnosis can happen to any pregnant woman?
I really don't know because I don't know enough about the disease.
Yes, because when a pregnancy occurs, a woman's genes change in their body, and it's possible that they're, at that point, dormant and they become more active during pregnancy.
Yes.
Why do you think that?
It just seems like the type of thing that could affect anyone.
Probably.
Why do you think that?
Because things happen, and it's really sad.
That's really true. And yeah, it can happen to anyone, so.
Oh no.
Well, Courtland, what'd you think?
Excellent video. As always, our New Yorkers had a lot to say. You know, some of them knew about congenital heart defect and some of them needed some tips and tricks themselves.
They did. But, you know, one thing I think was kind of uniform. A healthy diet and exercise seem to be on the top of everybody's minds.
Our New Yorkers do love to talk about diet and exercise and, of course, food. We're living in one of the best food cities in the world.
Oh, come on, really?
Yeah.
I mean, you walk down the streets of New York and you get all these smells, and you know, from the guys standing selling things in the cart to walking by a restaurant, it smells so good.
Yep.
So I agree. And you know, New Yorkers for the most part get a lot of exercise because we walk everywhere.
Everywhere.
Yeah, absolutely. Well, Courtland, our interns did a great job. Our friendly New Yorkers, opinionated and very well educated, so I'm glad to see that. Well, now our favorite time of the show, we have Alix coming in. And I want to go through a few basic pieces of information before we sit down with Alix and talk to you about congenital heart defects. So here we go. CHDs affect nearly 1%, or about 40,000 births per year in the United States. About 25% of babies with a CHD have a critical CHD, and infants with critical CHDs generally need surgery or other procedures in their first year of life. Infant deaths due to CHDs often occur when the baby is less than 28 days old, or the neonatal period, that's called. About 97% of babies born with a non-critical CHD are expected to survive to 1 year of age. About 95% of those same babies are expected to live to 18 years old. So the population of people living with CHDs is definitely growing. Well, Alix, good to have you here. It's good to see you.
It's good to see you too.
It's been a while. We met a couple of years ago at a walk, as I was telling everybody before you got here. And you've had quite a journey, and you continue to have a journey, and we want to talk to you all about that.
Okay, what would you like to know?
Well, Alix, again, thank you so much for joining us today. We have a lot of people in our community that we know have been affected by CHD in one way or another, whether it's mother or actual patient. So this is going to be a very great show for many people. Can we start by kind of going over your experience with CHD? What were the events leading up to your diagnosis?
Originally, I was diagnosed with something amorphous called failure to thrive. They didn't have a name for it then. I was a blue baby. I wasn't getting oxygen, and I was very small and continued to stay small throughout, well, up until my first surgery. Your statistic about having surgery in the first year, they hadn't pioneered that yet. This was very experimental, and the mortality rate was crazy high, especially for somebody with my complications of CHD. I had a fairly rare set of congenital heart defects. I had 5 of them. So I was in exactly the right place at exactly the right time with great doctors and people who were experimenting, and the experiment worked.
Wow.
Yeah.
So failure to thrive,
I know,
is that kind of a catch-all or what? I think
no one gets away with that anymore.
Well, I think the principal called my family in when I was a kid in high school, and they said if he doesn't shape up, he's going to have that same diagnosis.
Right.
So that's kind of a catch-all there. But so take us back. What was your childhood like? So you have a CHD, and
it was quiet.
Yeah.
I didn't learn how to ride a bike till I was 12. I'm not a swimmer. I wasn't, we didn't walk. I didn't play baseball. I wasn't a sports kid. I sat, I read, I watched TV, coloring books. Now they're making a comeback. Paper dolls. This was, we didn't have internet. We didn't have iPads. This was
the good old days.
Exactly. Color forms. Remember color forms?
Yeah.
You sit and you amused yourself or with other people, but it was a lot of quiet play. And I learned to adjust and learned to sort of, when my friends like, oh, we're going to go ride to the, I got to go home. I'd make an excuse and absent myself because I just couldn't keep up.
Yeah.
So you mentioned that some of your treatments when you were first diagnosed were rather experimental. What were some of the treatments, your earliest memories of these treatments?
There really was no treatment. The first thing that they did was open heart surgery. There wasn't we're going to try this, we have this medication. They didn't have medications. They had nothing to throw at a family with a child that had these anomalies, except we've got this great surgeon. The guy was part of the heart-lung machine development. He was Christian Barnard's teacher. He taught the man who did the first heart transplant how to do open heart surgery. My cardiologist was trained by Helen Taussig at Johns Hopkins. So I come from a long line of people training other people, but I was one of those first kids that they did the open heart surgery on. I have 2 original pieces of Teflon patches from 1969 that are in there to create more chambers. I was born with 3 chambers instead of 4. So they really were recreating the physiology of a working heart.
So remind me again, what year was the first transplant?
The first transplant on an adult was 67.
67.
My surgery happened in 69. The transplant happened in South Africa, as you may or may not know.
Yeah.
Right? My surgery happened here in New York in 69. And very quickly, it was a great start, but I needed to have another one about 2 years later
Yeah.
to finish the repair.
Yeah. Now, we hear all the time from our members that they have the special bond or relationship with their physician, whether it be a cardiologist or an endo. And you're the same. Tell us about your relationship with your first cardiologist.
There was a woman who was a woman, which right away was a novelty. She graduated #1 in her class from Johns Hopkins, and her name was Mary Allen Engel, and she was at New York. Then it was called the New York Hospital. It's now part of New York Presbyterian. And I was her patient from the time I was 5 months old, and I was first brought to a cardiologist until I was 31, until she retired. So I was always part of a pediatric service because my issues were pediatric in nature. She was at my wedding. She was unfortunately at both my parents' funerals. She was there for me in a way that no other person, professional, anybody had been with me so consistently.
Yeah.
And she would come to see me every day when I was in the hospital. So I always knew that no matter how bad it got, she understood it. She was next to me. She was really my advocate, my cheerleader, and she wanted everything right for me. And I was lucky because I had her to facilitate this for me.
Yeah, she
Yeah.
sounds amazing.
She was amazing. She was smart and thoughtful, and she was a mom also.
Yeah.
And she was there when my kids were being born. So she really encouraged me to go live my life.
Yeah.
And that was the most important thing. I never felt that there wasn't anything I could do. So I think that helped a lot.
Yeah.
Certainly. So you mentioned 5 abnormalities with the heart.
Right.
You were 3 ventricles, missing 1, right?
3 atria, missing 1, right.
So what were the other abnormalities?
I looked up some of this because I have my operative reports, and the internet's an amazing thing, although you can fall down a rabbit hole researching this stuff, and at some point I just had to back away. But some of the things that I had, there's a separation of another part where I had 3 chambers instead of the normal 2. There was just a bunch of plumbing issues, as I call them, where they needed to visualize and then make the repair and replumb things. They call it now another catch-all called tetralogy of flow. It's a 3. It's very common, except I had 5 defects, not 3. And the combination that I had was something that I'm not sure how many of us actually survived that. But I think part of it was I was young and feisty. I had this great team cheering me on, and my mother was not taking no for an answer. Nope.
Well, based on your personality, I could see that, right?
Yeah.
So you have a couple of surgeries, and then you're going along, and then things start to happen again.
But understand, I had a 30-year stretch of everything's fine. I was good from the time I was 10. I had my neck surgery, almost 30 years, at 37. So I had college, I had kids, it was a really extraordinary, I had medication, I followed up, always followed up, always under care. And at that point they started developing congenital adult subspecialty. So I was part of that as well, because a regular cardiologist wasn't quite sure what the heck was going on. So this was much to my advantage of having people who knew about kid patients growing up.
Yeah.
And then I also had sort of 2 surgeries back to back. I had a valve that just went, that happens sometimes. Even in people without congenital issues, you can have a valve replacement.
Right.
So time is going on, and did you realize when the valves started to go bad, did you realize something was going on, or were you
I thought I was out of shape, I was gaining weight, I was putting on water weight, and I was retaining water because I was in congestive heart failure, but I didn't know that's how it presented. Now I know more. If I start to retain water in my abdomen, that's my signal. Go to the doctor, go to the emergency room. Because that's when you need to be looked at. So I had my tricuspid valve replaced, and then it needed to be replaced again a couple of years later, just something wonky with that actual valve installment. And then again, that was 15 years ago. Now, is it a mechanical valve, or? At the time, I was still too young, and as a woman, you don't want to start getting involved with taking blood thinners all the time at a certain age. So I had a tissue valve. And in fact, when I started feeling unwell This year, they thought maybe the valve, they have a lifespan, they do need to be replaced,
Yeah.
but the valve's still in great shape.
Oh, good.
Yeah.
So I could imagine, spending so much time in the hospital as a child and then again having these surgeries as an adult could take quite a psychological toll on someone. How do you manage to stay positive through all these treatments?
I think when I was young, that's what was expected. I know I was rewarded for good behavior, more color forms, more paper dolls, more coloring books. I saw the kids who were crying and whining, and it just, you didn't think about it in these terms then, but you expend so much energy being negative. I was reserving that energy for healing. So and I had very positive people around me. So I learned quickly to, my mother used to say, pull up your socks and just keep walking forward. I think now the expression's turned into suck it up, cupcake. But that's basically the mantra, just you gotta do this.
Yeah.
It's terrible, it's awful, boo, let's go.
Yep.
You'll be okay. Now I do it for my kids. I don't want to scare them. I wasn't planning on being a sick parent. I thought I was okay, but you just never know. So for them, I try to be tough because I don't want them to worry about me. That's not what they should be doing.
Well, one of the things we hear of often is the power of positivity.
I agree with that.
And so, and I think you recognize this at a young age, being so positive, and as you said, channeling your energy toward healing and being positive and having those, those positive energies around you. How about your siblings? I mean, they're watching you go through this. Were they equally as positive?
I don't know what they were thinking, but I know what they were exhibiting. And they all rallied around me. They still do. It must have been tough for them to have a sibling who was not doing well. It's scary. It's really scary.
Yeah.
But there was some really good psychiatric help at the hospital. Child psychiatrist named Lee Salk, whose famous brother, Jonas, keeps polio away from all of us. So Lee was a psychiatrist, and he really pioneered this talk therapy with kids. It wasn't, we're putting you to sleep and you're going to get ice cream when you wake up. It's, hey, this is awful, but we got to do this and you'll get better. And I seem to recall the whole family being involved in this, maybe with me there in the room, without me there, but they were also instructed to keep my spirits up, and I think it just helped everybody. Look, it's not easy to do, and if you're going to fall apart and you're going to have a moment where the panic sets in, and that's okay, but try not to let that control you. Try not to let that take over who you really are.
Yeah.
A while back when you were here, we did your 360 interview, and we talked about what could potentially have been the cause of your CHD. Can we revisit that for a little bit?
I was told, and again, it's a suppose and an idea, that perhaps my mother had a fever at some point during the gestational period. It was a long time ago. She's no longer here to speak to it. You can't avoid everything.
Right.
And not every mom that's got a fever is going to end up with this, and sometimes you don't know what's going to happen. I'm hearing your tips, which were great. You can do everything within your power to have a healthy, happy pregnancy. There are certain things that just happen, and you deal with them and hope that now there's way more of a fix now than there used to be. I mean, there are infants in utero that are having this surgery that get a mesh or a patch or a fix. I had to wait till I was 7. And anything could have gone wrong in those intervening years. So the technology is extraordinary, and it's not the death sentence that it used to be. So please don't think that it is.
So speaking of technology, so now you're on the waiting list for a heart transplant.
Correct.
And I noticed you, when you came into the office today, you have a little pouch, and I'm not sure if people could hear the beeping noise. It goes off occasionally. It beeps a few times. But Alix, tell us about your pump here and what it is and what it's doing.
I am being delivered on a 24-hour basis an intravenous medication called an inotrope. which is an actual medication that helps the heart pump more effectively. About 3 months ago, all of a sudden, I was exhibiting signs of aggressive and end-stage congestive heart failure, which really wasn't anything that was on my list of things to do, and nobody saw this coming, but I knew enough to get to the hospital, and they worked to get the fluid off with medication, and it just kept coming back quickly, which means my heart, as it was explained to me, is contracting, which it's supposed to do, but it wasn't properly releasing. So I'm getting part of the action that I need. And what the heart does is then send blood to the other organs, and it wasn't sending blood with enough power to my kidneys to help them evacuate the fluid. That was the physiology of this. So what this inotrope does, and that's what this medication is it actually keeps my heart pumping and releasing so that I can walk around with this external pump, getting the medication I need, and not have to stay in the hospital until the transplant. That could be months.
Yeah.
So I get to be doing what I want to do, go out, come to the city, go places. I'm not, going downhill skiing anytime soon, but it gives me a chance to live as normal a life as I can while connected to this pump.
Now, you don't go home at night and take it off and hang it up in the closet. You're wearing this 24 hours a day.
24 hours a day. I change the bag myself. I've been taught to do that. Somebody comes and changes the dressing for the installation of the port, which is great. I mean, there's a lovely thing, so I don't have to go visit somebody. They come to me. It's part of the prescription. Shower, sleep, whatever it is that I'm doing, this comes with me. In fact, I had a different bag, and I searched for this one because it's a little smaller, a little more portable, and I can wear it much more comfortably. It's not the prettiest thing in the world, but nobody bothers me when I wear this. They leave me alone. And I know everything's here. I'm safe, and I can, go to the park, go to the mall, I can drive with this. I wouldn't do that if I was in the ICU.
Yeah.
That would be awful for me.
Yeah.
Yeah.
So other than the inotrope, did your doctors talk with you about any other things you can do to make sure your heart stays healthy until the transplant?
Unfortunately, healthy is a relative term. I can keep the rest of me healthy. My heart it needs help to the point where it's beyond what I can control, and we've talked about that a little bit. But I get up, I walk around. I can't sit and do nothing. I have to keep my circulation in good shape. I have to make sure that my head's healthy to face this next surgery. Transplants, as they say, it's the big show. And I've had open heart surgery before. That part doesn't scare me. It's the other part of this. And there's other things that I'm going to need to do more afterwards. Medications, different medications, immunosuppressants, anti-rejection drugs, those kinds of things, but it will extend my life significantly.
Yeah.
Yeah.
Well, Courtland and I are both on the organ donor list, and we have been since we were eligible to be on a list. And so I would encourage everyone out there to please get on the list. It's a very easy process. It takes no time at all. And I think one of the important things is share with your family your will and your desire to be an organ donor, because when that time comes, your family plays a large role in making decisions after you pass on. And if your family doesn't know that you, in your heart, want to be an organ donor, then that may not happen. So please get on the list. I urge you, talk to your family about it. Make it known what your desires are. If you were to sum everything up and talk to the audience about the journey that you've been on and now on the list in organ donation, what would that final message be?
It's funny you use that word journey, and it's something that for me was never, it's just who I am. And I think that growing up with this, you get a much different philosophy than if all of a sudden this is thrust on you. It's terrifying. I'm very matter of fact about it and have a positivity that I think sometimes people look at me like, it isn't that there's something missing, it's something very strong inside me. I really fought very hard to be here. And I think that my family knows that, my kids know that. They support and encourage me. My friends have been amazing. I've heard a lot of Tin Man jokes and, you know, damn Yankee song, you gotta have heart. Yeah, we get that's funny, but it's true that if you surround yourself with good people and the positivity, and it really makes this so much easier. I can't imagine going through this alone without friends, without family. So surround yourself with good people, because someday you may need it. You can be there for them, but they're going to be there for you.
Yeah.
Yeah.
Very well put. Well, Alix, thanks so much for coming in. It's
Thank you.
great to see you. We're going to stay close, and we're going to have you back on a few more times. I'm sure we want to hear all about the post-transplant and everything that you're up to, because I know it's going to be fantastic. So thanks again for coming in.
Thank you.
I'd like to thank our viewers for tuning in, and I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthy360.com, and our podcast can be found in the iTunes Store.
But we love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest. We use the hashtag #RealStories when posting, and we'd greatly appreciate it if you would do the same. On behalf of Dave Duplay and myself and the entire Healthy O360 family, we'd like to thank you again for joining us today, and we look forward to seeing you next week when we're chatting with Dr. Aylan Kirsan about innovative new treatments for brain tumors.